Dr. Nadeem, what types of myeloma treatment classes are currently available?
Yeah, so we started, over 3 decades ago plus with just having, basically steroid medications available and some older chemotherapy drugs that weren't very targeted at all. And that was basically all we had up until about, a little over 20 years ago, where immunomodulatory drugs were first discovered to be effective in multiple myeloma. And that included thalidomide and now a commonly used agent called lenalidomide or Revlimid. After that, we had a next class of medications approved called proteasome inhibitors that work differently than the immunomodulatory drugs. And then we combined all of these therapies about a decade plus ago and showed that that was better than anything else that we're doing before that. So combining the steroids with the immunomodulatory drugs and proteasome inhibitors became standard of care. And then we had the next class of drugs approved in 2015 called monoclonal antibodies. And that's the first time we had monoclonal antibodies approved for myeloma. And they first started in patients that had relapsed myeloma. And then they've made it all the way up to frontline therapy with the drug, in particular called daratumumab. And now what we're doing is entering an era of combining all four of these therapies, just like we did 10 years ago with 3 drugs, and showing that combining 4 drugs is actually better than 3. And the important thing there is that it's not necessarily adding cumulative toxicity. These are targeted therapies. They all work differently, but they all work really well together. So now combining these agents has allowed us to really treat the disease effectively and allow for patients to tolerate the therapies. And then over the last couple of years, we've now entered kind of the next renaissance in myeloma where you have immunotherapies. And these are sort of true immunotherapies, in some cases, taking the patient's own T cells and then genetically modifying them to recognize myeloma cells and putting them back into patient. This is called CAR T cell therapy. And that's now approved for patients with multiple myeloma. And that, again, just like the previous drug, sits in patients that have, at a space where patients have had multiple relapses. But we're now studying that earlier and earlier. And that, along with another class of drugs called bispecific antibodies that also use your T cells, it would be a different mechanism. A lot of exciting things going on, and we keep adding to the available agents for this disease.